My name is Sancy Leachman, and I am an adjunct professor of dermatology at the Oregon Health and Science University, and I'm also the chief medical officer for SkinBit. Yes, my focus session this year was on rural access to dermatology, and what I was focusing on mostly was the War on Melanoma data that shows that telehealth is one of the ways that you can truly help people in rural areas. And this is a really important problem in the United States, but in particular in Oregon, where we have large rural areas that are underserved with respect to dermatology. And so what we showed was that if you are able to give access to them either through a direct contact with a dermatologist or through contact through their primary care provider that can do a consultation with the dermatologist, then what you've done is you've really helped improve that access and gotten the care to them faster with a higher quality. And so that was the big take-home message of my keynote. Yeah, I think one of the biggest groundbreaking things that I saw at this meeting actually was not a piece of research this year. It was a group that has formed called Rural Access for Dermatology. It's a society, a new society, and they really are getting some momentum around trying to provide better care, better access to dermatology across the whole country. And so even though it's not direct research, it is sort of like implementation science in a way, where what they're doing is they're figuring out how do you provide that kind of care to people that otherwise wouldn't have the access. And that includes every facet of it, getting trainees to be able to participate in rural access, getting mobile health involved, getting the ability to have people travel out there or help and assist with telehealth, like what I was doing in my session. And so I think that's really one of the biggest take-home messages from this Congress for me. Yeah.